Hello, welcome. My name is Kristen Grace McGarry, and I'm an integrative holistic healthcare provider. I'm a health and lifestyle alchemist, and I'm known as the health detective because I help you get to the root of symptoms. And I am committed to sharing my Facebook Live series with as many people as possible to inspire and empower you during this COVID-19 pandemic. Many of us are at home, and I'm seeing this as an incredible opportunity to upgrade your health and your life in so many ways. So I'm sharing through this series many different tips and tricks and processes that have been successful in my 23 years of practice with thousands of patients to help them achieve optimal health, to really step into their vibrant selves in a new way. A little bit of background about me. I used to be in Western medicine. I was pre-med and I wanted to be a physician, Western medical physician, and became very, very sick and learned about Asian medicine. And so I transferred, after working in the emergency room as an EMT, I decided to move toward Asian medicine, and did. And then I moved towards functional medicine and combine all three. I also studied biological medicine, homeopathy, herbology, advanced cranial sacral therapy, somato-emotional release, brain work from the Bruno Chickley Institute, visceral manipulation, neural therapy, perineural injection therapy, many, many things. So I have a big toolbox, and I want to share as much as I can with you so that I can give the power of your health back to you so you're empowered and you can work as a team with your healthcare providers. Now today, I'm sharing a very, very important topic. It's about pain. And not only am I going to share my clinical experience with you, but I'm also going to share my personal experiences with you. Many, many, many years ago, I had a chronic pain disorder. Eventually, after a couple of years of suffering and thinking I was crazy, going from doctor to doctor, and they're just shuffling me along, telling me to go see a counselor because it's got to be in my head. Well, I guess parts of it were in my head because I had heavy metal toxicity, but that wasn't all. I had real physical pain. It wasn't just in my head. Now, we understand with the work of Bruce Lipton and with the work of Dr. Joe Dispenza that it's true. A lot of stuff is actually coming from our head, from our unconscious. And so I do want to address that level as well in this video. But in telling my story, I'm going to share more at first about the physical aspects. So with fibromyalgia, I had horrible, horrible pain and spasming all over my shoulders and back. I had over a dozen severely painful trigger points. There were mornings I couldn't get out of bed. There were days where I couldn't lift my arm to brush my own hair or feed myself. I had a new baby at the time, and there were times I couldn't even hold him to nurse him. My mom would have to put pillows under my arms so I could nurse my baby. It was intense. And I gained almost 30 pounds, 35 pounds almost, after I started taking pain medication and antidepressants for pain. The Western medical physicians were doing their very best, but they were just throwing medication at me because they didn't really understand what was going on in my body, and they didn't have the tools to peel off the layers to get to the root. But I understood there was something different. There was something more happening in my body than what met everyone's eye from a Western medical perspective. And because I had some Western medical training, and because I was beginning Asian medical school, I was very determined to get to the root of it. So I started my own research, my own detective work, to discover what was going on in my body and figure it out. So then I could be sharing that and customizing it for others. And so as I bring up pain, I want to also offer to you that I don't believe pain is just in your head. And part of it is in your head. Because when we have pain, we develop these deep neural grooves in our brain around pain. And I had a patient once that'll explain this. I had a patient who had a bad car accident. I only saw him a couple times because he didn't live near me. And I think I only saw him twice. And this was before I learned perineural injection therapy, which I'll tell you about in a second. And he was asking for remote assistance with this pain. And he really just wanted supplements. He didn't want to do the deeper work, which is fine. And so I was making recommendations for natural anti-inflammatories to help with this pain. Well, he, because of his own path to healing, chose to begin taking pretty serious pain medication, Oxycontin, to help with his pain, and he became addicted to it. And his pain, because of how the brain works, his particular pain, because he was addicted and he needed this medication or the pain would get worse, his brain actually habituated to that and would cause pain, so he would take more of the medication. Once he went into a treatment center and detoxed from the pain medication, his pain was gone. So his brain was actually creating more pain for him so he would reach for the medication because he was addicted. So pain is tricky. It's not only in your body, it can also be in your brain, in your head. And it shapes us, it shapes our habits and our thinking, and it can really get us down. And there are techniques to help shift your thinking and work with the pain in a totally different way. In our culture, I'm very aware that we want to push pain away. We don't like it. Get it out of here. We want to suppress it. We want to ignore it. We want to cover it up. We want to, medicate it. Please get the pain to go away. I understand. I had chronic pain. I really, really get it. I've had incredibly intense dental surgery and I had no painkillers afterwards. I get pain. I gave birth, a natural birth, to a very large baby with a midwife. I get pain. And I'm going to share a concept of how to work with pain that may surprise you. And it's just the first step. There are actually several steps on the path to working with pain. So I'm going to just introduce you to some of them. And if this work sounds appealing to you, then please reach out to me so I can get you more tools that you need to help facilitate you ultimately healing and resolving it. So the first step to working with pain is to actually befriend it, embrace it. And this can be difficult because we have this habit of pushing it away in our culture, of medicating it. So what would it be like to get to know pain that you're feeling in your body? Different. It's probably something not many people are talking about. How would you befriend your pain and get to understand it in a different way? Ask it why it's there. What's the message you have for me every day? What are you waking me up to? What's going on? Why are you here? I believe pain is a messenger. Pain is here to teach you something, to educate you about something, and to help you release and resolve something. So listening to pain in a new way is really important for your overall health and well-being. So first is to embrace the pain, get to know it, get to understand it, befriend it, rather than pushing it away and medicating it. And journal about this, whatever you discover about yourself and what the pain is telling you. What is the message the pain is bringing to you? What is it trying to open your awareness to in your body, mind, spirit, and emotions? I've discovered that very often pain has a block of emotion, energy, and memory in that part of the body. And so listening to it in a deep way, going underneath the pain, using your mind to imagine going underneath the pain and asking, what's the emotion there? What's the memory there? What's this message that's here? And writing notes, taking notes, and sending it love. honoring it rather than pushing it away, listening, showing up with ears to listen and a heart to listen of what may have been stored in your body, and perhaps you dealt with it in your head. Maybe you had therapy, maybe you had EMDR, maybe you've done some other trauma work and dealt with it, and it's still locked in your tissues. So this is a way to go deeper with it. So this is one tip around pain. I'd like to share some other tips with you. There are tools that I'm going to be talking more about this week that work with the unconscious. And these tools are a quantum technology to getting to the blocks in your unconscious that may be contributing to the manifestation of pain in your physical body. One of these technologies I'm going to go deeper into an explanation of this week is called the Lifeline Technique by Dr. Darren Weissman. He's a well-known Hay House author and a friend of mine. And I've been a Lifeline practitioner, certified in Lifeline for many, many years, and was also certified to teach it. The 1, 2, 3 plan, the beginning part of Lifeline. And I assisted Darren in many, many, many classes all over the country and even in Australia. And so I'll introduce you to that later. You can check him out, look up his books. They're brilliant. All right, the next technology I would like to introduce you to is something that is very much based in Western human physiology, and yet many, many doctors are unaware of this technology. So if you have pain and you think you've done everything, make sure that you are doing perineural injection therapy. If you have not done perineural injection therapy, you have not done everything, and it is like a miracle how it works. I have studied with Dr. John Liftoff out of New Zealand personally, and have learned the technique from him and from one of his main students. And it is life-changing. Perineural injection therapy. It could very easily put the osteo doctors out of business, because people who have frozen shoulders and joints and pain and back pain and joint problems, so many things, they don't need surgery after they get perineural injection therapy, usually. And it's a miracle. I can tell you many, 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 many stories of patients that had severe pain, and in as little as 1 session and as many as 4 were completely out of pain. It's like a miracle. And it's not because we're covering up a symptom. It's because we're dealing with the underlying issues that surround pain. I'll give you an example. There is a nerve cell called a nociceptor. And these nociceptors are pain receptor parts of our nervous system. There are these special cells. And these nociceptors signal pain and inflammation. And they can signal challenges in the nervous system when there's neurogenic or neuropathic pain. And when you feed these cells dextrose, which is what we're injecting, which is basically a kind of sugar, it does not go into your bloodstream. It's going into the matrix of the tissue around nerves, nerve bundles, and nerve pathways, nerve channels. It's like magic, and it resets these nociceptors. It's incredible. There's a lot more to it. This is just one piece. When there's also blunt force trauma, there can be damage, and these nerves respond in a particular way, and the inflammation can limit how they take in nutrients. It can prevent them from feeding themselves, which causes more pain. And glucose can act like food. It's nerve food. So you're feeding the nerves, and it's like pain instantly shifts. And it's not just localized, it's in the entire system, your nervous system. So it is brilliant and incredible. There's only about 3,000 of us practicing this around the world. And so please contact me please, I'm happy to guide you to Dr. John Liftoff and his website to help find practitioners in your area that have studied with him, that understand how to effectively apply this treatment. It is a miracle. I can give you an example of a gentleman I worked with from Australia who had broken his collarbone, and he had come to a retreat that I was helping coordinate. He was 24 hours post-operative because his collarbone was in half, broken in half, due to a four-wheeler ATV accident. He had a plate put in and a bolt put in, and he came to the retreat with his wife and beautiful children, and he was going to do his best to help, but probably not participate much. And I said, oh my goodness, we've got to get this under control, because he was popping pain meds every hour and doing other things for pain, because he was in a ton of pain. And this is a big, strong Australian guy. And so we did one session, and I did perineural injection therapy, and he was immediately out of pain. He couldn't believe it. He was just beside himself. But I told him we weren't done yet, because I work very, very comprehensively. And so then I applied advanced cranial sacral therapy techniques and really listened to his body to see where the trauma had been stored in his physical body. Not only did he have the trauma of the initial accident, but also the trauma of the surgery. And things shifted in his physical body, things unwound themselves. It was incredible what I was feeling under my hands, and I really understood that he was going to feel very differently after this session. And that combined with the perineural injection therapy was right for him at that time. And when he got off the table, he said he didn't realize how much stress he had been holding in his body and his shoulders. And he said it felt like it had all been lifted, and that somehow he had much freedom of movement in his body, his shoulders, his upper body, and his heart felt more open. He continued to not have pain that full day and the next day. Zero pain, 24-hour post-op. Zero. He went from a 9 out of 10 to a 0. It was like a miracle. It was just his was designed to heal and needed just a little bit of guidance and assistance. By the third day of the retreat, so this is 48 hours after his surgery, 72 hours after his surgery, he says, hey, Kristen Grace, look what I can do. And he is full range of motion with his arm. And I said, stop, please don't, because he still had stitches that hadn't come out, even though they looked completely healed after just a couple of days. It was amazing. And it was still healing, even though he didn't have any pain. And he had full range of motion. He had a plate and a bolt. It was a miracle to him. And I was so pleased that he was feeling so much better and didn't have any pain, never took another pain pill or an Advil, nothing. So this is the power of perineural injection therapy. And this is the power of your body's ability to heal itself. Hi, Ahu, my dear. So good to see you. Thank you for joining us. Thank you so much. So let's talk a little bit more about pain. I've been giving you a couple of modalities that can work with pain. I gave you some tips to lean into the pain in a new way and befriend the pain rather than pushing it away and over-medicating it, etc. I also would like to introduce you to another therapy. If you have pain in your body and you said you've done everything and you have not done neural therapy yet, different than perineural, it's different. Different substances are injected, different techniques for injecting, completely different and equally effective. So if you haven't had neural therapy yet, please do your homework, find someone who does neural therapy. I'm trained in neural therapy as well. I just attended the first neural therapy conference here in the United States in Orlando, Florida, a couple months ago, right before the pandemic struck. We had 20 different countries represented, about 136 physicians from around the world and a couple of people like me. I'm not an MD, but I have a license to inject in Colorado, and I'm an acupuncturist and certified in functional medicine, so I was qualified to be there. I've been studying neural therapy and homeopuncture, which is the injection of homeopathics, for many, many years. And so it was phenomenal. Phenomenal. So neural therapy I will save for another video, but I wanted to plant the seed. If you have pain, please reach out to me, and I'm happy to give you my tips. I'm happy to work with you as an individual to help you dive more deeply into the root of where the pain is coming from and what it is telling you. What is the message in the pain? Next, I'd like to offer advanced cranial sacral therapy and Asian medicine acupuncture for pain. Both of those modalities are spectacular, working with the structure, working with the tissues, the fascia, the energy systems, the organs. It also works with the nervous system, the brain. I was part of the Colorado board for acupuncturists. It's actually an association of acupuncturists. We don't have a state board per se in Colorado. And we presented to various insurance companies incredible research on how effective acupuncture was for back pain versus Western medical interventions and pharmaceuticals. Acupuncture had such better results that the insurance companies were excited to include acupuncture into their programs for their people. And so please, if you have pain, find an acupuncturist. If the acupuncturist does not help within 6 to 8 treatments, please find a different one. It's an art and everybody has a different style. Personally, when I do acupuncture, I'm combining it with many other modalities, so it's very, very comprehensive. Many acupuncturists will leave you in a room because they have multiple rooms going, and that's okay. It can still be very effective. But for me, I like to keep my hands on you. I like to add advanced cranial sacral therapy or neural therapy or perineural injection therapy or brain work, or lifeline technique to really offer you a comprehensive approach when working with the individual biochemistry of your body and your life. Next, I'm going to offer homeopathy. When you're working with pain, homeopathy can be an incredible modality, not just taken orally, but also injected. This can be incredibly beneficial when working with pain patterns and also old habits in your physical body, your emotional body, your mental body. Now, next, when we're talking about pain, and pain as a messenger, I've offered you a couple of tips in how to lean into the pain and talk to it and receive the messages it has. I've offered you many different modalities that you can begin to look into so that you can add tools to your toolbox and continue your own journey with pain, getting to what's underneath the pain rather than just covering the symptoms of the pain. I want to help you really, really get to the bottom of it. I'm going to just check my notes to make sure I've covered everything. Oh gosh, language. This is huge with pain. I really, really, really wanted to empower you with this last piece for today. This final piece today is language and how you talk about your pain, the pain. I used to say, my fibromyalgia, my pain, my migraine, my Hashimoto's thyroiditis, my food sensitivities. I used to talk that way and own my pain. And when I did that, it would literally create a neural network that associated my identity with the pain pattern, with the symptom. So what I want to offer you today is to begin looking at and shifting your language around symptoms and pain. Rather than saying, my pain, my migraine, my back pain, my fibromyalgia, please create some space between you and the symptom, your identity and who you are, your higher self and this symptom, because you are not your symptoms. You are not your pain, I promise you. So as you create space with language, you could use words like the pain, the migraine, the fibromyalgia, the back pain, the food sensitivities, the sinus infection, the fever, the cough, the allergies, whatever it is. Watch your language and notice how many times you might be self-identifying with it by using the word my. So this is a huge tip in shifting your language so that you're not identifying with your symptoms and the pain patterns that you're having. Instead, you're creating the space, the pain. It's not who I am. I am not fibromyalgia. I am not migraines. I am not gut sensitivity, food sensitivity, celiac. I am not high blood pressure. I am not diabetes. I am not insulin resistance. No, I am Kristen Grace McGarry. And I want to always strive to be in my higher self. I want to be the light. I want to continue shining brightly. And that's how I'm going to identify. All these other symptoms are not who you are. You are the light. You are in your highest self. You are centered and grounded in your being, even if you're having symptoms or stress. And so I'll leave you with this thought to contemplate, to sit with, to feel into, disidentifying with your symptoms and calling them the instead of my. Thank you so much for joining me today. If you listen to this replay, type in any questions you have. I'm going back a couple times a week and checking all of the Facebook Lives to see if people have offered questions or experiences, or if you have a particular topic you would like me to address. And please type it in. You can find out more, as well as schedule a consultation with me through my website at guthappyketo.com. GUTHAPPYKETO. guthappyketo.com. I look forward to hearing from you. Blessings, and bye for now.